All right, so it's December, it's almost Christmas. So what we're doing is we're doing a breast reduction camp. So we do a pro bono surgery for some patients with very, very large breasts. And with me is Dr. Nelson and Dr. Daniel, two plastic surgeons who've obviously done many breast reductions themselves. But what we're basically doing here is we're exchanging notes, we're sharing ideas, and we're basically learning from each other. So the technique I use for those Gigantomastia operations might differ a little bit from the ones you guys use. So we're doing it together now, and basically all of us benefit. And at the end, I think the patient will be very happy to have smaller breasts and go through life much lighter. How are you doing? You good? Yeah? Okay. So basically, you're here for a breast reduction. Tell us about life with big breasts. What makes it difficult?
I'd say, I think the most difficult thing for me is walking into a room and the first thing that people notice is how big your chest is.
Right.
Or walking around the market and then you have women trying to sell you clothes for babies because they think that you're breastfeeding.
Really?
Yeah.
Wow.
And also knowing that in your family you're the only one with like a big chest, no one else has this.
Really?
And if you have to get like outfits made or t-shirts, they say, okay, please remember for her it's an XL or a size higher.
So what size are you now? Bra size?
Currently I'm at 38K.
Wow.
Yeah.
I didn't even know it went up to that.
I think K is the highest. When I realized, okay, so also the most difficult thing again was trying to find brands for my size.
Sure.
And so there are stores that came into the country that were doing big bust bras. That's when I think I made the first fitting and I realized I was a 30J. That was back in 2018. Yes, I was a 30 double J. So then fast forward because of weight gain and other things, so I now became 38K currently.
And often, even when you lose weight, the breasts still stay the same size, right?
Even at when I was a 30 double J, I was at my smallest. I really had a tiny waist, but yeah.
And you work as a nurse, so how does that affect you?
Well, first things first, you can't run.
Yeah, okay.
You can't run quite well when there's an emergency, so they keep getting in your way. Either you have to hold them or you have to go at a slower pace. Pain again, back pain because of the long hours walking around. That's also another thing. And there's another thing as well. Not getting the right scrub size. So early in the year, we were getting new scrubs, and this tailor said, "Oh, you know what? I can't make you a scrub because because you have a really big bust and I can't hack it."
Okay, well, we gave you the third park scrubs now, so why don't we do a little experiment? We're going to draw on the scrubs now, your current size, and then maybe after 3 months, once everything is settled down, the swelling is down and everything, we'll try on the same scrub and see how it fits you then. Should we do that?
Yeah, sure.
Hopefully, the breasts will be up here in the normal position once we've done the surgery, and then you'll also feel much more comfortable. In Gigantomastia, we take at least 1 kilo off. I think in your case, probably 1.5 kilo from each side, but we'll tell you the exact grams after the surgery, okay? So I'm always important that the measurements are correct. 21.5. Yeah, 21.5. So I like that. So now, basically, this is where your nipples will be after the procedure.
All right.
All right, so we did the surgery. It was 2 hours 40. I think the stitching took a long time. But how many kilos did we take off?
On the right side, you took off 2.2 kilos. Wow. On the left side, you took off 2.1 kilos.
So 4.3 kilos in total. And we really tried to make them look symmetrical, but we just didn't get that extra 100 gram of the breast. And then if we look at the pre-op pictures, then we can see that indeed the right side was bigger, right?
The right side was indeed bigger than the left side.
Yeah, so the pedicle was the same length, so it was both 38 centimeters, but just the volume was much higher. So anyways, 100 grams is not a lot, right?
It's not a lot considering that the right side was actually bigger than the left side. Yeah. So it makes a lot of sense that there's a difference in the amount of volume of tissues that have been removed. True. Yeah.
So I think what's the aftercare now for her? When will she be able to go back to her work?
Right now, actually, the aftercare involves actually wound management and drain management, because she'll go home with a drain in place. When to remove the drain, that one is guided by the output. So if at all the output is anywhere between 20 cc's or actually 30 to 20 cc's, then we can remove. If it's above, then we need to keep it a bit longer. Then again, for the dressings that she has on, then once the dressings are soiled, that one we need to change. But for now, she has the dressings on, and she won't be able to at least pour water or shower up until we at least she has to keep the dressings dry. Yeah.
Yeah, right. And we put a special compression bra which supports the breasts as well. For her body size, they're the right size, but I think what do you think happens when she loses weight?
Well, when she loses weight, the breast volume may also lose some kilos. So we expect that as she loses weight, then the breast symmetry also goes on with her body habitus.
Yeah, exactly. It's all about proportions, right? The breasts that she had now were way out of proportion for her body size, and now the proportions are back to where she wants to be. And I think that was worth a morning on Jamhuri Day. Okay, thanks so much, guys.
Hopefully the patient will be happy and pleased with the results.
Thank you so much.